One of the traditional methods of imposing statism or socialism on a people has been by way of medicine.
Legitimate questions for us?
Yeah, I've been having a question with these gentlemen about health care.
HR 676, Medicare for all, where everyone pays for it out of their own taxes, so it's prepaid insurance. Is that what we're talking about? Is that what we're
I was talking about...
Perhaps HB 311 even for Illinois, Medicare for all, where it's paid through through our taxes and all our paychecks, so that no one gets to lose their homes through bankruptcy. Yeah, hey, what the hell, right? I mean, is that what we're talking about, Medicare for all?
I was talking about eliminating the federal barrier prohibiting you from shopping across state lines for health insurance. I was talking about expanded health savings accounts, portability,
I'd rather have the Canadian plan, to be perfectly honest.
I know a lot of people...
You want socialized medicine?
No.
You said you wanted the Canadian system. The Canadian system is socialized medicine. Do you want socialized medicine?
Well, first of all, what in your opinion constitutes socialized medicine? Just
government run.
It's not government run, though. No system is government run except maybe in Cuba, arguably. Canada pays all the people in Canada, France, Germany, Japan even if all their flaws, paid through their taxes. And they all have medical care where they can go in and get taken care of, not for free. They do have some small charges that they might have to pay for, upgrades perhaps.
What the hell's wrong with socialism?
But democratic socialism, you're damn right that's what I want. I'm tired of all this BS crap that we got now.
I want socialism.
I mean, come on, you want for-profit corporations telling you what you can and can't get done? At least with the government, we can vote the bastards out if they screw with us. You can't vote out a corporation. You know, for what?
You can't vote for a
What are you going to do? If your company that you work for has a contract with AIG, what are you going to do? Vote them out and go with somebody else? Go with Blue Cross Blue Shield? Come on. Seriously? At least with the government, you have the ability to tell them, hey, I want this or that.
Yes.
That's us. We are the government.
Yes.
So,
you are... speaking about the Canadian medical system, you are aware about the long waiting times for MRIs and things.
Really? You want to go with me on that?
That's something, man.
No. The same waiting periods that they have in Canada are no different than here in America. I mean...
If I went to one of the hospitals or medical clinics here in Rockford, I could have an MRI today.
Yes,
in Canada, it would be weeks and months wait.
No, it wouldn't.
This guy doesn't have insurance.
No,
he couldn't get an
it
MRI.
might be, you might wait a couple of days at most. I've been to Canada several times. I've talked to probably well over 100 Canadians, and I was a truck driver for 3.5 years. I was in Canada plenty of times. I also spoke with the guy who runs the Canadian healthcare system up in Saskatchewan, Canada, for a whole hour when I was doing some research for a paper in college. Trust me when I tell you, all the information that you're spewing about the Canadian system is bullcrap.
It comes from Canadian newspapers.
What? The ones that are maybe in bed with Rupert Murdoch? Come on. Seriously?
Actually, most Canadian newspapers are quite liberal.
Boring talking points. They've been so debunked over and over, and you still want to play that game?
There's a reason why Canadians have a longer...
They also live longer than us. That's right. Do you know that doctors actually get paid by the Canadian government, not as employees, but as doctors in hospitals to take care of the people? When they get somebody to stop smoking, to lose weight, they actually get paid extra money. So it's imperative for the doctors that they actually get people to stop smoking, to stop drinking, to lose the weight, to stay healthy, and it actually works to the betterment of all Canadians so that ultimately their health care gets cheaper and cheaper and cheaper as time goes by. Our system...
Yet their taxes go up and up and up and up.
Well, so the hell what? So what if you pay 40% in taxes? At least you're getting your health care for free. You don't get to lose your home up there. No country
your health care is
world,
free, but you don't get treatment.
No country in the world allows their citizens to go bankrupt due to medical bills. Take that to the bank. Take that to your boss, David Hale.
Now, in our country, under our free enterprise system, we have seen medicine reach the greatest heights that it has in any country in the world. Today, the relationship between patient and doctor in this country is something to be envied any place. The privacy, the care that is given to a person, the right to choose a doctor, the right to go from one doctor to the other. But let's also look from the other side at the freedom the doctor loses. A doctor would be reluctant to say this. Well, like you, I'm only a patient, so I can say it in his behalf. The doctor begins to lose freedoms. It's like telling a lie, and one leads to another. First, you decide that the doctor can have so many patients. They're equally divided among the various doctors by the government. But then the doctors aren't equally divided geographically. So a doctor decides he wants to practice in one town, and the government has to say to him, you can't live in that town. They already have enough doctors. You have to go someplace else. And from here, it's only a short step to dictating where he will go. This is a freedom that I wonder whether any of us have the right to take from any human being. I know how I'd feel if you, my fellow citizens, decided that to be an actor, I had to become a government employee and work in a national theater. Take it into your own occupation or that of your husband. All of us can see what happens once you establish the precedent that the government can determine a man's working place and his working methods, determine his employment. From here, it's a short step to all the rest of socialism, to determining his pay. And pretty soon, your son won't decide when he's in school where he will go or what he will do for a living. He will wait for the government to tell him where he will go to work and what he will do.